I'm Dr. Seth Ammerman. I'm a pediatrician and adolescent medicine specialist and addiction medicine specialist. I'm glad to be here, albeit remotely, to tell you about the services that my colleagues and I provide at Alliance Medical Center. Before I start, I do hope that you and yours are doing all right during these difficult times of the COVID pandemic. For the services we provide, I'll start with the preteen, teen, and young adults. We do annual checkups, physicals, immunizations, sports physicals, all those regular kinds of care that preteens, teens, and young adults need. We also do a variety of acute or sick care, all the usual things that adolescents may have, ranging from headaches and stomach aches to acne, menstrual problems, the wide range of problems that we are glad to help you all out with. I want to let the teens in particular know that by state law in California, there are 3 categories of services that starting at age 12, you can get for free and confidentially at registered clinics in California, which includes Alliance Medical Center. These 3 categories of services are first, reproductive health care, and that includes pregnancy tests, all the different methods of birth control, sexually transmitted infection testing and treatment, HIV counseling testing. The second category that's free and confidential are substance use services. So if you have an issue or know someone, a peer, a friend who has an issue with tobacco, alcohol, marijuana, other drug use, we can help you or them out with the substance use. The third category are mental health issues. So if you or a friend or a peer have problems at home, at school, in a relationship, a boyfriend or girlfriend, or are suffering from things like anxiety and depression, we're certainly seeing a lot more of that during this COVID pandemic, unfortunately. But we can help you out with those issues as well. Again, by state law in California, we can provide those services free and confidentially starting at age 12. Another aspect of state law in California that once you turn 18, you are considered an adult for all healthcare services. What that means is that if you come in at age 18 and older, for us to discuss any of your healthcare issues with anyone else, whether it's your parents, other family members, a friend, we absolutely need your written permission to do so. Now, for all the routine services that I mentioned at the beginning, such as annual checkups, physicals, sports physicals, headaches, stomach aches, menstrual problems, acne, if you're a minor, meaning that you're under the age of 18, parental consent is required for all of those services. Generally, once a parent or guardian gives consent once, that consent lasts for an entire year of service. In any particular visit, you are able to get both the confidential services, again, reproductive health care, mental health, substance use help, as well as the non-confidential services. If both are needed at the same visit, that's not an issue. If you are a minor and are not being supported by a parent or guardian and not living at home, you can actually consent for all the services, not just the confidential services. And we ask that when you come to the clinic. And obviously that can change up with time because you may not be at home at one time or being financially supported by your family as a minor, but then that may change up. But again, if you're a minor not living at home, not being financially supported by a parent or guardian, you can consent to all healthcare services by California state law. I'm also an addiction medicine specialist, as I mentioned, and we do have what's called a MAT clinic, M-A-T, which stands for medication assisted therapy. And that's using a medication, the most commonly known one is Suboxone, for patients who have heroin use and want to get out of that. And this is a clinic that I and my colleagues run very closely with behavioral health. And there's a lot of great psychological support and social support, which brings me to the next kinds of services that we have. We have really a wonderful behavioral health team at Alliance Medical Center. Additionally, we offer nutrition services. So if you have questions about healthy nutrition, or you're worried about your weight, or you're worried about an eating disorder, or you just want to know how to eat healthier, or how can I improve my physical activity, we have a wonderful registered dietitian, Laura Stever, who can provide nutrition and fitness counseling services for you. Pre-COVID, I and my colleague Patty Young were doing school outreach at middle and high schools in the area. Since COVID, we have changed that up to remote outreach, and we hope that that will continue that way once school's back in session. It does seem like schools generally are going to start back remotely. And you'll be notified of that if you're in local middle or high schools. And we love having you participate in those sessions. They're fun and I think highly educational as well. Currently, most of the visits we are doing are remote, meaning telephone visits or video visits. We have the capability of doing either. Some patients prefer video, some prefer telephone, some don't have a preference. We'll ask you. Obviously, of course, sometimes you have to come in person to be seen for certain issues, say if you're sick or need certain kinds of birth control, like the birth control shot, or the Nexplanon, which is the birth control that goes into the arm and lasts 3 years. So if you need to come in person, we do arrange that. We are currently doing COVID screening at the clinic, and all patients are screened for COVID symptoms prior to entering the clinic to ensure everyone's safety. I will end by saying that pre-COVID, we had a comprehensive wellness center, CWC, that was in the Hillsburg Community Center on Hillsburg Avenue near Grove Street. That has been closed since COVID, but we hope that as things renormalize, that will reopen, and that will be specifically focused on the preteen, teen, and young adult population. Currently, all of our services are at the main clinic, if you need to come in person, at 1381 University Avenue in Healdsburg, right next to Healdsburg District Hospital. It's been a pleasure talking with you today. And if you have any questions about any of our services, please feel free to call the clinic and you will be routed to the appropriate person to answer your questions. And I look forward to providing services for you, not only during this tough COVID time, but as things get back to normal. Take care.